Alright guys, today we're going to talk about 5 nursing tools that we use. This is just a fairly basic overview and some tips and tricks that I picked up along the way. Nothing really fancy, just kind of a quick overview, something I've kind of wanted to do for a little bit. So let me know if you like it, let me know if you don't like it. I would like to do more sort of tips and tricks videos like this. So just let me know if you do or do not care for it. For the first one, we're going to talk about the stethoscope. Stethoscopes are pretty much the go-to stereotypical tool that everyone thinks of when they think of nursing. You use these to hear heart sounds, lung sounds, belly sounds. When I was in dialysis, I used them to hear people's veins, their accesses. You hear the thrill and listen for blockages and whatnot. Some tips about these things. So a lot of people will put them, around their necks. If you do this, I do not. I typically put mine in my big pocket of my pants. But if you do put them around your neck, one thing to note is the oils from your skin will actually break down the material that they're made out of and will almost dry rot. So in order to keep that from happening, you can get sort of like a sleeve made out of cloth to go over across the entirety of the stethoscope, everything that's made out of that rubber material. Another thing to note when you're using a stethoscope is the earpieces are not exactly, like this. They're kind of shaped like that. What you do is you take the earpieces where the holes go and you face them towards your eyes. This will help you hear. So basically take them and they're going that way. So in your ears towards your eyes. That will help you hear in them. Another thing to note is right after you put them on, I always do this. I'll put it on and I'll take my bell and I'll tap it. Not very hard, but I'll tap it just to make sure that I'm listening out of the right bell, because they can twist if they have multiple bells on the end. That's how you basically listen to each side of them. Always make sure you have proper placement depending on what you're listening to. Sometimes if you're on top of a rib or something, you're not really going to hear the heart or the lungs, whatever it is you're trying to hear. And so always make sure you have proper placement. Take care of your equipment. If you take care of it, it'll treat you right. Stethoscopes can become very expensive very quickly, and you can also cheap out on them. My advice is to buy one with interchangeable earpieces and interchangeable bells. You can get them for about 40 bucks. The best bet about that is not everybody's ears are the same. If you get them with the interchangeable earpieces, you can change them out to fit your ears. Or you may have to buy other pieces, but at least the stethoscope itself will accept different earpieces, and it's not sort of that hard plastic going in your ears. Those things hurt, and they are just aggravating. I don't much care for them. So number 2 on this list is something that everyone has probably seen a lot here lately with the pandemic going on, and that is thermometers. You have a just plethora of thermometers, oral thermometers, tympanic thermometers, thermometers that goes in your ears, thermometers that are rectal, thermometers that go under your arm. Be sure you know which thermometer you are using. You do not want to get rectal and oral mixed up. You don't want to go oral to rectal or vice versa. Always make sure you know your equipment. Sometimes these things can be in Celsius. Here in America we use Fahrenheit. So the first time I saw a temperature of like 37, I was a little bit worried, but then realized, oh, I'm going to have to do a little bit of math on this. Sometimes the thermometers will switch back and forth between Celsius and Fahrenheit. Sometimes, depending upon your documentation, you want to go ahead and stay in Celsius. I don't really remember ever using Celsius, but I have used kilograms, so, which is the metric system, by the way. Always make sure you have the correct probes if you're using a oral thermometer. Some probes will not fit various thermometers, and if they are too thick or too thin, your thermometer won't exactly work, to specifications. So make sure you have the proper equipment for what thermometer you are using as far as probes or where it goes. Also, a lot of these tympanic thermometers, some of them touch your forehead, Some of them, I've seen the ones with the laser that can zap you across the room. I don't really think they're very accurate, but they do have them. I've seen people use them. Like I said, I don't think they're very accurate, but people do use them. My favorite is the oral. I feel like it is the most accurate, especially the ones that take roughly 10 to 15 seconds. I like the fact that it takes a little bit of time to give me an answer. I feel like that's a more accurate answer, but could just be me. Number 3 on this list is the blood pressure cuff. I'm going to talk about 2 different types. That is automatic or manual. One thing to note with the automatic blood pressure cuff is cuff placement. Typically, they either have a picture on the cuff or they have arrows pointing to where they go. Typically, they go upper arm, and you want them facing the inside of your elbow, and they have arrows pointing or a picture showing how to place it. Sometimes they will go on your leg, and sometimes they'll have different pictures for that. Make sure if you're using an automatic blood pressure cuff, you have the proper size. A peds cuff won't fit someone who's obese, and an obese cuff won't fit peds. You're going to get different numbers if your cuff is wrong. I have, believe it or not, gotten one backwards that was an automatic cuff, and if you know how a cuff works, it kind of squeezes. Well, I put it on backwards somehow, and it just ballooned out off the arm. So make sure you have proper placement and proper direction of the cuff. Make sure you know how to use the automatic machine. When it comes to manual cuffs, number 1, make sure you know from the get-go how to get the air out of the bulb. Some of them will pull down and some of them will actually push up. So make sure you know what you're using. A lot of times the manual cuffs are better used in emergent situations as they are more accurate. Make sure before you're in an emergent situation you understand how your manual cuff works. I typically go to 180 on the meter and then drop down. The first number you hear through your stethoscope, which is here and here if you're using the arm, the first number you hear is the top. Hear it until it stops beeping, stops beating. When you stop hearing a beep, that is your bottom number. Remember, you got to push or pull, go slow, watch them fall, boom, 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 boom. Those are your numbers. If you hear it at 180, I go up by 20. So like I said, I start at 180 and then I'll go 200, 220, 240. 240 is the highest I've ever been. But I believe that some of those cuffs will go to 300. That's probably about to pop your arm off, pop your hand off when they hit 300 on those things. But like I said, with these manual cuffs, be sure you know how to get the air out of them. There's probably nothing more aggravating than having a blood pressure cuff at 220 and you can't get the air out of it. So, know your equipment. Number 4. This machine does one thing only. It is a glucometer. Glucometers are used to measure blood sugars and immediate blood sugar on typical diabetic patients, or typically on diabetic patients. This is not an A1C. This is just a simple immediate blood sugar number. So, one thing to note with these is know how to use them. Some of these machines you put the blood on the machine. Some of these you put them on like a strip and then you insert the strip into the machine. Some you insert the strip then put the blood on the strip. You got to know your equipment. I was on a diabetic unit at a hospital at one point in time and used a bunch of different glucometers, and we typically taped how to use them on the front of the case for the equipment. Depending on the sugar or how often we had to get it, we would use different glucometers. One thing to note with the lancets, or the little needles that you use to get the blood out of a person, is instead of using and going straight in the center of a finger, you kind of want to go a little bit to the side. This will help get the blood out. It's also less painful. Also note that if you get one finger, get the next finger, and then the next, and then the next. Rotate sites. You don't want to just keep using the same finger. It's going to get sore, it's going to get calloused, and it's going to, you know, not work as well. So that is a basic understanding of a glucometer. Also, alcohol. Of course, you're going to clean your finger, you know, with alcohol before you stick them. Note that alcohol can influence a blood sugar. If you get a number that is really, really low or really, really high, always check it again. Don't just go with that number automatically unless your patient is showing signs and symptoms of that blood sugar. But I'm always going to get 2 if I get something like 13 or 700. I'm going to get a second one. So that is the glucometer. And finally, number 5. This is my favorite tool, one that I feel gives you the most accurate information, the quickest. It is my go-to. It is the first thing I use, and I actually have one here with me. It is this guy, the pulse ox. Now, the batteries are dead in this one, so it won't come on, but very simple. You just put a finger in there, and it's going to give you 2 numbers, typically. A pulse rate and an oxygen number. This one's dead, but that is my favorite machine. It gives me, in my opinion, the most information the quickest. If I put that on and I know I've got a patient that baseline is confused from baseline, I'm going to check the oxygen level first. If it's 88, okay, I understand we need some oxygen on this person. I'm going to call the doc. I'm going to hook you up to 2 liters. Or, you know, if you're already on oxygen, we're going to take further actions. But that little machine right there just gives you so much information so quickly before you really start your assessment. It leads me into my next steps. That is always my first one. That is always my first thing to go to in an assessment, or really in any situation to where I'm taking a look at the patient, you know, outside of just communicating with the patient. If I know your pulse and your pulse ox, your oxygen level, if I see that they're good from the baseline, I can move on to other things. If I look at them immediately and say, ooh, that pulse is high, ooh, that pulse is low, ooh, your oxygen is low, I'm going to take further actions immediate from that situation, and I get that information just from using this little guy right here. So my very favorite, my very first go-to, this is the first thing I use before I even listen to anyone, is the pulse ox. The pulse oximeter is the proper name. I just feel that the information that you obtain from it is the best, and I get it first because A, B, C, you know, airway, breathing, circulation. You already know if they have an airway, if you can see them breathing and circulation, you're going to get an oxygen level and a pulse right then and there. So those are 5 nursing tools, 5 tips, or really more tips and tricks that I can give you. Hope that helps. Let me know if you like it. Let me know if you don't like it. Thank you much.